Good afternoon, Dan.
Good afternoon.
How are you?
Good.
I'm Yo-Yo. I'm the health and wellness coach here for your correction exercise program. So from now on, we have a health consultation, which takes about 25 minutes. We'll have conversation about your health status, your exercise experience and preference, so I can structure a safe and effective correction exercise program for you, achieving your goal in time.
Okay, cool.
Okay. So, could you tell me your age?
34.
Okay. In your last medical examination, was there any health marker that was out of normal range?
No, I'm very healthy.
No. So, do you have any family history of vital organ diseases like cancer, heart?
No.
Okay. Have you ever been injured of any kind?
My ankle was injured probably 15 years ago
15
when I
years ago?
played basketball.
Okay, which side?
Both sides.
Both sides?
Yeah.
Just once?
Yes.
Do you have any restrictions of your ankle
I don't.
mobility right now?
I think no any limit.
Do you have any pain, like chronic pain or muscle pain, any kind of recurrent pain?
Now I just have after training I feel my muscle pain, but otherwise no any pain in my daily life.
Okay. Do you have any joint perceived restrictions when you do any daily move?
I think my shoulder mobility is not good because when I'm doing some shoulder press, barbell shoulder press, I think the position and the mobility is not good enough.
Both sides?
Yes.
Both sides.
But I think my left side a little better than my right.
How about other movements besides overhead press? How about bench press or push up? Do you feel any
No.
restriction or
Just
imbalance?
just overhead.
Okay. What exactly is that restriction?
Like when I push barbell overhead from my side view, I can't keep my barbell straight with my torso.
So it
It's
cannot be
not straight.
you cannot be vertical. So you press when you press overhead, it
So
will end
I
like
arch
that.
my torso.
Oh, okay. And that's that is obvious. You can see it from
Yes.
the mirror or the
Yes.
video.
Also, I compare other CrossFit athlete. I saw my my movement is not good.
Also, you do CrossFit.
Yes.
I have done it before.
Oh, really?
Are you going to do the 2025 Open?
No, really. I'm supposed to spend over a year to preparing for probably 2026 Open.
Oh, maybe we can do that together because
Oh, nice.
I'm planning to participate the Open either 2025 or 2026.
Sounds good.
Or we
Okay.
can train in pairs
Yeah.
together. What is your current resistance training right now? Is it based on CrossFit?
No, it's based on bodybuilding,
Okay.
isolated training.
So 4 times per week, all focused on hypertrophy.
Yes, and I want to improve my strength, especially shoulder, my press,
Improve your shoulder mobility.
yeah,
Okay.
mobility and stability. Because I want to practice more about snatch and clean and jerk.
So now your shoulder mobility is restricting you from pressing the bar vertically overhead.
Yes.
Okay.
I think the limit will let me have more risk for get shoulder injury.
When you do snatch, do you do it do 1 or 2 reps or do like more than 3
Depending
reps?
the weight. Sometimes 1, sometimes like 8 to 10.
Do you know your maximum snatch rate?
My personal record is is 16 kilograms.
60 kilograms. Okay. And how about shoulder press?
Strict shoulder press is 55.
55. And can you press 55 kg for right now?
Yes, but the body position is not good.
So you're able to press 55 kg overhead with arching?
Yes.
Okay. Could you tell me your like time schedule right now for?
Usually now I'm go to the gym every Tuesday, Thursday, and Saturday and Sunday. So which is 4 times per week, 4 times a week, and also I have to working every Monday, Wednesday, and Friday.
So what is your work? Is it sedentary?
No, I help the supervisor to preparing the gums for rent.
So you walk around a lot?
Most time I walk and stand walk.
Do you do any outdoor exercises?
Sometimes I just run outdoor.
How frequently do you run outdoor?
Recently, probably twice a month.
Twice a month. When you run, do you have any restrictions or any perceived imbalance or any
No.
discomfort in
No.
anywhere? Okay, great. Do you smoke or
No.
vape?
No.
Do you drink
No.
alcohol?
No.
How about sugary drink?
No.
What is your stress level? Do you feel very stressful?
Not really. Just sometimes my neighbor's dog barking. I don't have good sleep. I think I don't have good sleep, but I have probably 6 to 8 hours sleeping times a day.
Do you have any questions?
Just curious if the correct exercise will link or affect my strength increase. Especially like lower body days, I will focus on like increase my strength, like heavy weight back squat or even deadlift.
Okay. I mean, yes, like theoretically, static stretching inhibit the maximum strength performance. And we're going to assess your joint range of motion, mobility, and we'll do movement analysis to determine whether your restrictions are mild or severe. If it's mild, I plan to structure 2 corrective exercise sessions per week for you. If you're concerned about your strength performance, I can put those exercises before your hypertrophy training. And also, you mentioned that your strength is based on lower body. And if your restriction is mainly like your shoulder, if it's upper body, it doesn't really influence because you won't be doing lower body static stretching before that
Sounds good.
session. Okay, and do you have any other questions?
No, thanks.
Okay, cool. Now this is an informed consent. I can give it a rate. Basically, it states that all the information about yourself provided was correct and true, and you acknowledge what's happening next, including both movement analysis and joint range of motion assessment. And based on that, I'll structure a correction exercise program for you, and you will follow my instructions for your own safety. and the effectiveness of the exercise. And of course, all the information about you will remain confidential. So
I just sign here and
yeah, if you
my name and
acknowledge,
date.
yes, and please sign it. Okay, cool.
Or if you're finished.
Then we're going to
Sweet.
do
Good
some
luck.
practical assessment. Two kinds of assessment. First is movement analysis. So you're going to do certain kind of movements, and then we'll do like static range of motion measurement. For the first assessment, which is the movement analysis, we will be doing like 5 or 6 movements consecutively and 2 sets of movements and 10 times per set. After you do 10 times, you just relax and rest, and whenever you're ready, perform another 10 times. I will be walking around observing and evaluating your movement, so you have to count the reps yourself. And if there is any extra set needed, I will tell you. Okay? So the first one would be overhead squat. We have a comfortable stance, usually shoulder width, and we'll raise our arms overhead and keep it there, and we will squat to a comfortable height and stand up. And relax for a bit, and whenever you're ready, just perform another 10 times. And the next one is a single leg squat, so hands on the hip and shift your body weight to one leg and raise the other leg and keep that leg raised and try to squat to wherever you feel comfortable and stand up. Good. Next one is the push-up. So we'll be starting on the ground, the present position, and chest touch the ground, forearms perpendicular to the floor, and we try to press up, and then we do 10 times push-up. So this one is the shoulder rotation test. We'll stand back against the wall, and we'll raise our arms, and then we'll try to externally rotate the shoulder, try to touch the wall with the back of your hand. If you can't, just reach as far as possible, and for 10 times. And then for shoulder internal rotation, you try to touch the wall with the palm of your hand. So the next one we're going to do is assess your joint range of motion. We have 9 sides to assess. So firstly, would you please lie on your back? We'll start with your ankle. And towards your hip. And go. Shoulder extension. So Dan, based on your assessment result, you do have compromised shoulder flexion and also compromised shoulder internal rotation. So that means when you press barbell or dumbbell overhead, you will end up like this. And in that case, you won't achieve an optimal weight used. And also it will interfere some of your daily activities, such as like reaching hands backwards. And so from now on, our corrective exercise program will definitely address that issue, improve your shoulder range of motion in the next 6 weeks.
Okay, sounds good.
Okay.
Morning, Dan. So I have structured a corrective exercise program for you based on our health consultation and your practical assessment results. So today I am going to demonstrate that corrective session you are going to be doing twice a week from now on for the next 6 weeks. And our goal is to improve your shoulder mobility, particularly your shoulder flexion, extension, and internal rotation for 10%. So I have measured your current range of motion degree. So we will try to improve that overhead press performance. Also, what I'm trying to do here is that I try to incorporate all these very easy to access small tools for you, so you don't have to go into the gym to complete these workouts. You can either do it inside your house or in your garden. So from now on, we'll be doing a 5-minute warm-up to get our blood flowing, get our body warm. We'll be jogging from here along the street for 5 minutes. I will jog with you and I will count 2.5 minutes. After 2.5 minutes, we turn around and run back. You will be running at the pace of like 50% of your normal like gym running pace. Okay, so let's go. Now, so then from now on, we'll do the workout of the corrective exercise. We've got 4 phases. And the first one, we're going to use this foam roller to release some intense or tight muscles. We have 3 sides. For each side, I'll count 1 minute for you to do that exercise. The first one would be our thoracic spine. So what we're going to do is that we'll be lying our mid-back down on the foam roller and grab our opposite shoulder and lift our hip, try to support our body with the feet and roll that mid to upper back on that foam roller. So try to pull your shoulder blades out and expose that thoracic spine area. 3, 2, 1, excellent. Now, the next one would be our lats. So we'll be doing 1 minute for each side. What we're going to do is we'll be lie on our side and step that upper leg in front of our body, and then try to extend our elbow. And if you already feel like moderate pain here, you can just stay here. And if you can roll that foam roller, just lift your hip and roll. Try to support your body. How do you feel?
A little pain.
A little painful? Yeah. You can actually control your body weight onto that foam roller, so it doesn't need to be very painful, just moderate discomfort. 3, 2, 1, let's change side. And the third one would be our pectorals. So we will be placing the foam roller 45 degree to the crease of our shoulder, and we'll be lie on our chest and extend that arm and support our body with single hand and try to shift our weight onto the foam roller. Just roll like very slightly, and you will feel that massage on the hips from here. Try to find that very tight area and try to release it. Keep breathing.
So the next phase, we will be stretching those 3 sides we just covered. The first one, we will still be using this foam roller for the stretches. So the first one would be the thoracic spine, and you will also feel the whole, like your anterior trunk, you will feel all the stretching. We'll be doing 45 seconds for each side and each exercise. And this one, we will be lie our mid back on the foam roller, and now we try to slowly just get our head touch the ground, and while exhale, you extend your arms and try to press the back of your hand to the floor. If you can't, just stay wherever it's the closest to the ground. And when you're done, slowly get the head up. Just keep it here for 45 seconds and keep breathing. When exhale, try to lower your hand closer to the ground. The next one will be our legs. So we'll be stretching both sides simultaneously. What we're going to do is we'll be kneeling on the ground, thighs vertical to the ground, and we'll place our wrist on the foam roller and roll it out until our arms extend. And exhale, we get our body weight down and feel the stretch under our arms, and keep it here for 45 seconds. When exhale, try to press your upper body down toward the ground a little bit. Next one will be stretching the posterior shoulder capsule, so over there. And what we'll be doing is we'll lie side down on the floor and get our arms 90 degrees. The palm of our hand will try to touch the ground, and we can get extra pressure from our other hand, and you will feel that stretch for the post shoulder capsule. And when exhale, if you can, give it a little bit more pressure wherever you feel mild discomfort and can keep breathing. Next phase, we'll be doing some muscle activation, so contract your weakened muscles a little bit. The first one, what we're going to do is using this stretch band. You're gonna get it on your wrist, and you start with the elbow flex and try to pull it apart. Get moderate tension and hold that tension there, and try to raise your arms overhead. If you can, extend your elbow, but no arching. Just keep it wherever you can stay your torso vertical. And I will count that tempo for you. 1, 2, raise up, hold for 10 seconds, and 3, 2, 1, down. Keep holding that tension, don't loosen it. 3, 2, 1, return. Nice. The last time. Go. 1, 2, raise, hold, 10 seconds. Keep breathing, raise the abs. 3, 2, 1, get down. 3, 2, 1, down. Very good. Now the second activation exercise will be we'll lie prone on the ground. So lie on your chest and palms facing down, arms like 30 degrees away from your body. And what we'll be doing is we squeeze our shoulder blades and lift our arms off the ground, and keep it 10 seconds and 3 seconds down. So we'll raise 1, 2, lift off. Nice, keep it, hold there for 10 seconds. Keep breathing. Excellent. Now, lastly, we'll be doing some integration exercises for all those sites you have been activated. So all these exercises will be doing 2 sets and for 10 reps each set. Then you can actually do these exercises either at home using these weights or using G dumbbell, weight 2-3 kg dumbbell to do it. And what we're going to do is that look, and we do external rotation of the shoulder and down. You'll feel the tension around your shoulder blade. Do you need a top here? Okay. So is it too heavy?
A little bit.
Okay, so let's change. Now this one is about 1 kg. Let's try it. Try to rotate. Nice. How does this one feel? Okay. Try to reach the end of the movement. Now the second exercise will be the Y raise. So we'll lie prone on our chest on the ground again and extend our arms 45 degrees like a Y. And we'll be retracting our shoulder blades and raise our chest and arms off the ground and down. Pull your shoulder blades down first and squeeze and lift off and down. 1, 2, 3, 2, 1. So this one is no holding on the top. So the last one we'll need an anchor for this resistance band. Walk back a little bit to feel moderate tension of that band, and you'll be doing a squat and roll. So squat to parallel, and while standing up, pull those elbows outside the rib cage. No shrugging, no arching. 1, 2, stand up. 1, 2, 3, down. 4, 10 times. Keep that abs raised. And retract the shoulder blades to initiate that movement. Inhale on the way down, exhale on the way up. Very good. Now we're done. We have finished all the exercises, and now we have a 3-minute cool down. What we'll be doing is a 61-point meditation. It's actually a breathing exercise, and what I'm trying to do is try to get your neural system to be calmed down, so you have loosen those tightened muscles through breathing. So what we'll be doing is we'll lie on our back, lie in a comfortable position, palms facing up, and close our eyes. We try to get that breathe to 3-second inhale and 3-second exhale. You will be listening to my voice, and I will guide you to shift your focus from between your eyebrow and to 61 points of your body. So now shift your focus on the first point between your eyebrow to the second point at the bottom of your throat. 59, bottom of your sternum. 60, bottom of your throat. 61 between your eyebrow. And slowly open your eyes. We're done. How do you feel?
Good.
Relaxed?
Yes.
Okay. So to sum up, we have a short-term goal of improving our shoulder mobility in the next 6 weeks through the Corrective exercise program, and you will be performing that the session I demonstrated today twice per week on the Saturday and Sunday morning to fit your schedule. It's before your afternoon hypertrophy exercise. And our long-term goal would be achieving the optimal performance of your shoulder, because when you do CrossFit, you will be doing a lot of overhead exercises. So improved shoulder range of motion will ensure that safety and effectiveness of your resistance training. And so our long-term goal would be incorporate one flexibility session in that in your workout routine. because now your workout lacks a flexibility component. Will be definitely facilitate that with the integration of flexibility training. So that's all. Do you have any questions?
Thank you.
Okay, cool, done.